The story begins in Wuhan, China, a city known for its vibrant markets and bustling streets. In late 2019, a new virus emerged, catching the world off guard. This virus, later named COVID-19, caused a mysterious respiratory illness that baffled medical professionals. Scientists quickly identified it as a coronavirus, a type of virus known to cause severe illnesses like SARS and MERS. The virus spread rapidly in Wuhan, overwhelming local healthcare systems and causing widespread panic. The first cases were linked to a seafood market, suggesting animal-to-human transmission, a common route for zoonotic diseases. However, the virus quickly spread beyond the market, indicating human-to-human transmission, which made containment efforts more challenging. The world watched with growing concern as the number of cases and deaths climbed in Wuhan, spreading fear and uncertainty. Little did we know this was just the beginning of a global crisis that would change our lives forever, leading to unprecedented lockdowns and travel restrictions worldwide. COVID-19 spread with alarming speed. Travelers carried the virus to different countries, leading to outbreaks in South Korea, Italy, and Iran. Within weeks, the virus reached every continent except Antarctica. The World Health Organization declared COVID-19 a pandemic on March 11, 2020. The virus's rapid spread exposed the interconnectedness of our world. International travel, once a symbol of progress, became a vector for disease transmission. Governments scrambled to implement travel restrictions, border closures, and quarantine measures. The world held its breath as the pandemic unfolded. The world faced a common and relentless enemy. Countries implemented strict lockdowns, restricting movement and closing non-essential businesses. Schools and universities quickly shifted to online learning. Social distancing rapidly became the new norm. Healthcare workers became frontline heroes, working tirelessly to treat countless patients. Scientists raced against time to understand the virus and develop effective vaccines. International collaborations flourished as researchers shared vital data and expertise. The world united in the fight against the COVID-19 pandemic. Section 4: Healthcare under strain. Healthcare systems worldwide faced unprecedented challenges. Hospitals were overwhelmed with COVID-19 patients, many requiring intensive care. Shortages of ventilators, personal protective equipment, and healthcare workers became critical issues. The pandemic exposed inequalities in healthcare access. Vulnerable populations, including the elderly and those with underlying health conditions, were disproportionately affected. The pandemic highlighted the need for robust healthcare infrastructure and equitable access to healthcare services. Section 5: Life in lockdown. Lockdowns brought life as we knew it to a standstill, creating an unprecedented global pause. Schools, businesses, and public spaces closed their doors, leaving communities eerily quiet and devoid of their usual hustle and bustle. Streets, once bustling with activity, fell silent, transforming vibrant cityscapes into ghost towns. Social gatherings were replaced by virtual meetings and online events as people found new ways to stay connected. The pandemic forced us to adapt to a new way of life, reshaping our daily routines and interactions. Working from home became the norm for many, blurring the lines between work and personal life and creating new challenges and opportunities. Online shopping and delivery services surged in popularity as people avoided crowded stores, relying on these services for essentials. The pandemic accelerated the adoption of digital technologies, changing the way we communicate, work, and entertain ourselves, perhaps forever. Section 6: The road to recovery. After months of lockdown, countries began cautiously reopening. Businesses resumed operations, and people returned to work and school. Social gatherings resumed, albeit with precautions. The world yearned for a return to normalcy. The development and distribution of vaccines brought hope. Vaccination campaigns rolled out globally, offering protection against severe illness and death. However, vaccine inequity became a pressing issue, with wealthier nations securing more doses than low-income countries. The pandemic highlighted the importance of global cooperation and equitable access to healthcare. Section 7: Lessons for the future. The COVID-19 pandemic has been a defining event of our time, altering the way we live, work, and interact with one another. It has tested our resilience, exposed our vulnerabilities, and taught us valuable lessons about the fragility of our systems. We have learned the importance of public health infrastructure, scientific research, and global cooperation in combating such crises. The pandemic has also highlighted the interconnectedness of our world, showing how an event in one part of the globe can have far-reaching impacts. It has underscored the need for collective action to address global challenges, emphasizing that no nation can tackle these issues alone. As we move forward, we must prioritize preparedness, invest in healthcare systems, and address inequalities that have been exacerbated by the pandemic. The lessons learned from this pandemic will shape our future, guiding us towards a more resilient, equitable, and cooperative world.